Sure.
Yeah.
I love it. So let's shift to Spryng a little bit more. And you've touched on this a lot during our discussion, but you've used Spryng in a lot of orthopedic, a lot of OA cases. What do you think types of patients do you think are really the best candidates for Spryng? Or is there that delineation?
So when I tell people if they, sometimes people want non-surgical options, and if you have like a complete cruciate tear, I'm generally going to be recommending surgery unless the patient's geriatric or other health issues or other things like that. But it's either not affordable or not something people just don't want to do it sometimes. And I do stem cell therapy in a lot of dogs that have like partial cruciate tears. Stem cell and PRP can, potentially heal those, and I have a lot that avoid surgery with that. But if they're completely blown out, then it's not going to be able to help them out. So I have had the Spryng make a big difference. Again, we got like I had I think like a 13-year-old Great Dane in a few months back. And it completely blown out the knee, and then it could barely get around because of it.
Yeah.
And we did the Spryng and bounced right back up, spring
Wow.
back up, and
Sprung
and
back up.
yeah, and getting around active and buy a lot of time. And it depends, some animals will last out a year or more. Some, they might just have a few months and they'll re-injure themselves. But it's kind of part of the test of the treatment is if they do really well and then they have a problem a year later or whatever, they'll probably be willing to do it again. The other ones are going to be, like I said, like a dog that has both knees blown out, or maybe they're traveling and they want to delay surgery for a few months or something like that. We'll do the Spryng injections, or pets that have arthritis and not like a fresh cruciate tear, but just chronic arthritis, whether it's hips, knees, elbows, whatever. I use different descriptions, but it's a high molecular weight gelatin. It stays in the joint. It kind of expands so the bone isn't rubbing on things. It lubricates, and it's kind of like almost like a liquid cartilage in there. And so it can make a very big difference in them. But just like with any therapy, I mean, nothing's 100%. So I always, tell the people that, it's an option to do for this. And then if I have like a case I've already done surgery on, but they had a meniscal tear, and they developed arthritis over time, even though the joint's stable. That's one of the things on the table to be doing, whether it's, you can do Adequan and other, other supplements, or Spryng is certainly one on there too, along with rehab and all the things. So that's on my list of any patient that has arthritis, of one of the things that we can do for them.